Welcome to Science, Health and Healing, Encyclopedia of Children's Health Core. I'm Dr. Majid. The subject of this video is Children's Facial Injuries First Aid Part 2. In Part 1, I describe first aid measures to prevent hematoma formation when there is a facial bruise and the skin is intact. I would suggest that you watch that program and then come back to this program. This program is when the skin is indeed punctured. Either there could be a tiny cut which you don't think really requires stitches, or indeed you may want to see a plastic surgeon who can guide you or your pediatrician whether the child does need stitches or not. But I'm focusing here on first aid. The first thing that I would do is get an ice pack and apply direct cold compression on the wound. In Part 1, I explained that you can take clean paper towel, or if that's not available, tissue paper, pull anything out of your freezer and just cover it with clean paper and just make sure that your hands don't touch that part of the clean paper or the tissue paper that's going to come in contact with the wound, and apply direct pressure. You will stop the bleeding, you will prevent the formation of hematoma, and apply the pressure in a rotary fashion like a pressure acupuncture type. And then start with very gentle touch. The child may be even further frightened when you put something cold. But soothe the child, take the child in your lap, and just in a few seconds, or 30 or 40 seconds, but keep the pressure on. Now when the child has calmed down, start putting more and more pressure. Our purpose is that some hematoma which forms, we disperse it while you are trying to get medical help. Because it will take you some time to get to a pediatrician or an emergency setting, where doctors can look at it and they can advise you whether the child does need additional care or possibly sutures. This is such a simple thing to do. You can save your child a massive black eye if the injury is on the forehead or just below the eyes, or a massive bruise around the mouth or on the chin, or a black and blue mark as the blood gravitates into the upper reaches of the neck. And it is safe, it is effective, it will comfort the child. And under the circumstances when you are at home or at school, the clean paper towel really is the cleanest thing. I would not look for a fabric, I would not look for, in fact, I would prefer a clean paper towel to actually a freshly laundered cloth towel, because it's likely to be much cleaner. And of course the other thing is that after the first 2 or 3 minutes or 5 minutes, you can change the paper towel or the tissue paper. And I have seen that you can pull any number of articles from your freezer. I'm describing what I've done myself. And what you're looking for is something which has a round, smooth surface, not a sharp angle. So you can roll the smooth surface, round surface onto the injured areas and get the help. Children's Health Core was funded and founded by Talat, my wife, and I, with the mission of providing authentic information for children worldwide, focusing on issues of nutrition, environment, and stress. We reach children also through their parents, grandparents, and their teachers. Please forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts. Help us spread this word. Should you want to participate at other levels in this effort, go to our website, www.kids123.org. There is a link, how can you help? And you can look at it, and we make several suggestions. And I hope that you will visit us, and I hope that you will consider participation at any level in this effort to provide authentic information for children worldwide, readily available. Until you meet again, may you be gracious, graceful, and generous in your spirit. Thank you.